Good afternoon, everyone, for joining us today on our Let's Talk About Cancer webinar series. My name is Dr. Monica Yellowhair, and today I'm co-hosting it with Ms. Desiree Jones. Today, our guest speakers are Callan Polonyemtawa and Kimberly Harvey from NACA in Flagstaff, Arizona. And so before we get started, can Callan, we'll start with you first, and then Kimberly, if you don't mind introducing yourselves.
Hi, everybody. My name is Callan Polonyemtawa. I work for the Native Americans for Community Action based out of Flagstaff, Arizona. We have 3 different sites, the NACA Family Healthcare, the NACA Behavioral Health, as well as the NACA main office, administrative office. And so we're all spread out throughout the city of Flagstaff. I work for the urban IHS portion as a special diabetes for Indians health coach through the urban IHS. And my background is really about patient health, community health.
Kimberly? I think you're on mute.
Hello?
Yes, hi.
Good morning. My name is Kimberly Harvey. I work with Native Americans for Community Action as a health coach. Work with also Callan in the Family Health Center area. I'm part of the Wellness Center and work with the community, the diabetes community.
Great. So can you guys discuss with us what specifically NACA, what you guys do at NACA? Expand a little bit more on that.
Sure, I'll go first. So with my role, I work in the clinic setting and with the special diabetes program for Indians. As a role, my role as a health coach, I provide one-on-one assistance with our diabetes patients, those who are living with diabetes, and then act as a liaison to, go through different resources that we have available to them. For one being the nutritionist, the other being a wellness center, hooking them up to a membership, and then also just providing lifestyle balance classes. I'll let Kim talk about the rest of the stuff that we do.
Under the same special diabetes program for Indians, I work with the diabetes self-management group. So I do the same as the health coaching with Callan, providing the diabetes education with the Family Health Center. We have 2 providers that we work with, Dr. Hershey and Natalie Mentz. So, and we also have the behavioral health department and the wellness center. Did I miss anything?
Nope. Desiree, I think you're on mute.
Yeah. Hi, Callan and Kimberly. Nice to see you guys. So my next question was, you talked a little bit about the services that NACA provides. So does NACA provide any services in addition for, sorry. I'm gonna go on. Does it provide any type of screening service within NACA for cancer?
With NACA, we have the fecal immunochemical testing, the FIT kit that we provide. So with our established patients that are the age range of 50 and over, 50 to 75 years of age, they're able to take a FIT kit home and we provide them that service at their home. And they bring that FIT kit back to us. We do the testing, and we give them the results and give them the education, one-on-one education. And then from there, if further referral is needed, if the test is positive, then we provide them a colonoscopy referral as part of the cancer services, cancer screening services.
So along with the FIT test screening, as well as the diabetes outreach that you guys provide and some wellness are there type of services that NACA provides, and like as far as other support services?
What was that part of you kind of went out there?
Oh, sorry. So aside from the FIT test screening for colorectal cancer and diabetes and wellness, is there any other types of support system services that NACA provides to the community?
For the community, through behavioral health services, they provide mental health and substance abuse services, along with the Wellness Center providing the fitness aspect with part of the wellness. Is there anything else I was missing there, Kellen?
As you know, during these times with the pandemic, we're mandated to close some of our services down, but we are slowly bringing them back up. Some of the stuff that Kimberly had mentioned, we are still maintaining through telehealth and telemed systems. So the behavioral health is a big one that we want to acknowledge, that all of our staff are intaking patients who may want to talk to somebody to receive counseling services. We are actually still doing substance abuse groups, holding those virtually, but then also those are the hours that are being accounted for that are still being served through the courts. So that's a big bonus for those who are wanting to get back on their feet during these trying times. And then the Family Health Center, again, telemedicine. We're going to try to get our program, the special diabetes program, back online, along with our cancer screening with our FIT kits to get those back online. I mean, we can mail those out. Those can be done at home. And this is a great time to catch people who want to utilize those test kits, at least the one we have. That would be a great tool for them to maintain their health screenings at home.
I think you're on mute, Desiree.
Sorry, I'm trying to never mind. Anyway, so you talked a little bit about the pandemic. So is there any other ways that COVID has affected NACA in relation to you talked about it closing down and telehealth. Is there anything else that may have been affected through the pandemic of the outbreak?
Right now, I think everything is like Kellen said, that we're using telehealth. I think right now it's just trying to catch the patients, working with them one-on-one over the phone. I think that's the main one, is just working over the phone. And everything's closed. We are still providing the services, so we are still staying afloat in that area.
Okay. Well, do you have any tips for staying healthy while social distancing? I know you guys cover a lot of different aspects of health. So do you have any tips for that, for staying healthy?
So staying healthy at home, what I've learned being home is being able to reconnect with family. You can cook with family, so being able to try something new, cook more with fresh produce, maybe even going through your pantry, meal planning, staying fit, so just trying to keep moving during this time, and practicing the social distancing, and being sure the stress management along with getting enough sleep. So those are some good healthy tips, or just taking the opportunity to be home with your family. Maybe clean, organize. These are some good things to get get through at home.
As they say, spring cleaning.
Oh, I've been in spring cleaning mode. I have the honey-do list. That's been never ending. So I've been pretty busy here building a chicken coop on my spare time to actually running and doing other things too. So, um, yeah, just try to find yourself something to do. Keep your mind busy, keep your body busy. It's all about mind and body, keeping that active, because once we become sedentary, then we start to see a lot of illnesses come through. Also, talking about mental health and mental illness. So, those things start to exacerbate with isolation and at home. If you're living by yourself, I would say, try to connect. It's not social. They say social distancing, but I would rather them have said physical distancing, because socially we can connect through social media like we're doing right now. So, those are things that we can do. Don't stop. I call my brother, every other night, and my mother, through FaceTime. So, those are things that we can do to connect using technology.
I like that idea. I think we'll start sharing that on our social media instead of social distancing, physical distancing. That does sound a lot better.
Kelly, I'm glad that you talked about cooking. So are there any types of traditional and or non-traditional foods that we can be doing to maintain a healthy weight and being healthy through this time while we're staying home?
So with cooking, I'm glad you asked, because I've actually taken a challenge. There's a number of challenges going out there, right? But this is not a TikTok challenge. This is a challenge that I've taken prior to the pandemic, to do a 30-day plant-based nutrition um, through our Food is Medicine program. This is a nationally driven type of plan. And so they wanted to test out Native American cuisine and Native American food. So, some of the traditional foods that we have at our disposal are things that we already have in our pantry, like beans. That can last a long time in our food stores. So, having that as a source of protein, we have what we call the three sisters: beans, squash, and corn. So we have squash there. People are starting to plant now in our area, and starting to, if you live in agricultural lifestyle, those are some of the times that doesn't stop. The illness is coming and going, but that way of life is not stopping. So we're still doing some of those things. Again, physically distancing ourselves in an appropriate manner, but still carrying on with our way of life. Other nutrition, I would say traditionally, would be, you know, um, we, the meat is being driven higher and higher, the prices, because of the availability, and it's probably going to be even higher now that we're hearing that a lot of the meat plants are their workers are coming down with cases of COVID-19. So, one of those things that with the availability not being there, the prices are going to get higher. So living with a plant-based lifestyle, I'm not pushing it on anybody, but it is a more sustainable way of living. I've realized through this course. By all means, I'm not a full vegan or not even a vegetarian. I wouldn't call myself that, but I do on occasion take part in a vegan or pseudo-vegetarian lifestyle where a week at a time I will go meatless. So relying less on meat and more on a full breadth of foods. Vitamin supplementation is another one. I just want to mention that I'm not a dietitian or nutritionist by training, but just through this program, because we're inside all the time. B12 vitamins are great to take to kind of uplift the mood. And then the other one is vitamin D. If we're not getting out there, we're not getting the sunlight, we're not getting the vitamin D synthesis. So, these are things that we have to also keep in mind that to keep our mental health and our physical health up is to maintain that adequate vitamin levels that we should be taking daily.
Do you have anything else to add, Kim?
So I'm part of the traditional foods. A lot of the like blue cornmeal, making the blue corn mush, you can get using like cedar ash as being part of the calcium. So just focusing on what you have. Blue cornmeal, I know I've been using that a lot the last couple days, just trying to keep up with that. And then there's the corn, the beans, like Kellen shared.
Great. So I know we touched a little bit about mental health and how isolation can have major impacts on that. So are there any types of exercises that we can be doing to enhance our mental well-being at this time? Not only aside from us being through this middle of the pandemic, but something that we can also continue to do once we get out of this current situation.
Yeah, so another part of my job is I'm a certified personal trainer. And so some of the things that, we've been seeing is that with the physical distancing and a lot of the things that are happening with home isolation, that people take it to the nth degree, right? And we're sitting at home, but it doesn't mean that we can't safely go outside and do things as little as, mopping, cleaning, your sweeping and cleaning in the house. Those are physical activities that are raising the heart rate up. But the other things that are simple that you can do are walking outside for a short distance, whether it be just down the block or around the block. Set goals. So maybe you do 2 times around the block to 3 times around the block the next week or the next day. It's important that we establish a routine because our mind focuses on patterns, and this is the great time to kind of establish those routines or keep routines that you've had previous to the pandemic and then carry those through afterwards. We've been, in this type of situation for about 3 to 4 weeks now. That's the effective amount of time to start a behavior change. If you started at the beginning of the week, if you haven't, it's not too late to start. You can start anytime. So given the restrictions to limit the limited availability of exercise gyms and locations, I would say just try to utilize what you have at your hands. Like, everything has weight. And so you can essentially get, some heavy cans or gallons of milk or whatever, I don't know if a package of TP would be effective if you stored up on that, but something that has weight and using it, for body weight exercises or adding a little bit more weight, doing lunges, squats, those are great, for anaerobic activity, strength training. Aerobic activity, I would suggest if you don't have a treadmill or bike at hand, doing a brisk walk or a light jog would be great to raise the heart rate up, or doing a 15-minute HIIT training. That doesn't take too long. Those are, HIIT is high intensity interval training. So what we usually do in our classes are 30 seconds on, 30 seconds off for 5 exercises for each circuit. Or each set, and you can do 3 sets. So, and that essentially takes probably only 30 to 45 minutes of your day. So, these are things that, we can kind of strive to hit. And the goal for 2020 people, Healthy People 2020 was 150 minutes per week of exercise. That breaks down to half an hour per day in a 7-day week. So that's not asking a lot, but just maintaining those goals.
Thank you, Kellen. Having you talk about that, I've just wondered, I know the Wellness Center did a lot of classes at NACA, and I was wondering if the Wellness Center is actually maybe doing anything on social media or doing Zoom classes or like providing little, you know, out, workouts that people could potentially do at home, or suggestions or like resources where they could do sort of exercises. Is the Wellness Center doing anything like that through their social media accounts?
Kim, can you answer that one?
Yeah, the Wellness Center, they have started a YouTube channel under NACA Wellness Center, and they have been posting fitness classes, videos on there. So from yoga to circuit training, and they've been doing that daily. So they are still providing services to the community, fitness programs. So if you can go to the Wellness Center website, NACA Wellness Center website, and they have been uploading the classes on there.
And our website is on the screen here, but we do have a website that's called www.naca, Inc. in one word, nacainc.org.
Okay, we'll definitely add that on here when we post this, so we'll be able to share that information. So going back to overall general health, what are some of the major differences that men and women should consider when it comes to staying healthy, since we both know physiologically men and women are different? So what are some of the major differences that we should keep in mind?
So, to help reduce risk of cancer and other diseases, it is important to keep up with our annual screenings and vaccinations. I know it's a little harder to do that right now, but there are clinics out there, including our clinic, that are taking patients in through telemed and telehealth. So those visits are virtual. We set that up for you. You do not have to have internet. Sometimes it's done just by telephone. Other times it may require you to have internet for video capability, but most of the visits have been effective as far as I know. And so men and women have similar lists for their health screenings, like blood pressure, annual physical exams, eye exams. Those things all should be carried forward as we age. The major differences for women, though, would be having the pelvic exam and the mammograms. Mammograms starting at age 40 and Pap tests starting at age 21. For men, prostate exams are important starting at age 55. So both men and women should begin a colorectal exam at the age of 50. And so we don't necessarily we refer people out to these services, and pelvic exams can be done in-house, but it would be worth, at least asking the question if we provide those services. At this moment, I know that we're not doing in-person visits, but we're trying to do as much as we can with our services that we have available.
Awesome. Thank you. So the question I had next was, do you guys have any recommendations on how to navigate cultural herbal remedies along with Western medicine?
So at NACA, we provide quality healthcare to Native and non-Native populations. So we're kind of unique. We, because we're in an urban setting, we welcome everybody into our doors, and we don't deny them access to healthcare. We are committed to providing compassionate and cultural sensitive care to our patients. So we encourage open communication with our patients and their traditional healers to allow a patient-centered approach. With that being said, a lot of times we try to work with certain types of herbal remedies and things that have been stated to us by our patients, and then make sure that they're not contraindicating with their prescriptions and medication. So, but that's to the extent of my knowledge. Kim, do you want to, add on to that?
Yeah, with that, yeah, I think just listening to the patient, like you mentioned, is what I've experienced from my experience is listening to the patient and following what they have been using as well, and just supporting if they do have traditional healers that they use, and just kind of go alongside with Western medicine.
I know we touched on this earlier when we were talking about the use of traditional foods. And since Kellen, you are Hopi, and Kim, you are Navajo. So just based on that geography and occupations, what are the similarities between with the use of cultural foods in the tribes in your area do you recommend to actually boost your immunity?
So there are many types of herbal remedies that I've came across, personally, passed down from generation to generation. One herbal remedy that kind of transcends both nations, is what comes to mind is the tea. It has different names, but Navajo tea, we call it Hopi tea, but it's the same plant from an Arizona shrub, and then there also is another tea that is more of an ephedra plant that it's again, these are labels and not my labels, but they've been named. One of them is either called the desert tea or Mormon tea or Brigham tea. They're all the same plant, but they were, what I've researched was that this ephedra plant, which is, if you those of you who are botanists out there, ephedra fasciculata. that's the origin of that plant, but this was used to treat common colds and also asthma and even hay fever. And I've grown up, with those stories of different medicinal plants that we've used to treat certain ailments for our own selves. And then there are many other remedies out there that help boost our body's immune system. Some foods that come to mind that each tribe shares are corn, beans, and squash, like we stated before, and then each provide essential nutrients and vitamins to our body. So like I was saying with that challenge before, food is medicine, and we've had it all around us. That's where a lot of these medicines are derived from. So, but that's what I can share. I don't know if Kim, do you have any other types of remedies?
Other remedies that I guess used growing up as well was like sage, or drinking sage and the cedar, or I've used tree sap, drinking and boiling tree sap as a form of remedy. So I don't know if those were kind of similar that you use for you as well, Kellen, with home.
Yeah, we there are different medicinal plants that we use, from cedar to sage, other types of forms of purification things. But and we can go into depth about these things, but of course these are things passed down through rites of passage and not readily or freely shared with other people, even within our own Native American tribes. So of course there's texts and literature out there that you can probably delve into that, but as a cultural teaching from my own standpoint, we're only taught to know what we need to know at that time until we earn the right to know the other things.
Great. Thank you for that. So, are there any important health issues that Native American men need to be aware of, and also Native American women? What health issues might they need to be aware of also?
So we talked about that a little bit before about the screenings for men and women. And it holds true that, you know, Native American men need to be aware of their prostate health, their colon health, and their cardiovascular health. Those are the top three that I see all the time when we do our, you know, statistics data and stuff. As well, for women, screenings that um, include examination of, you know, the breast, mammography exams, breast health, pelvic health, which are through Pap tests, and then colon health as well. We see colon health being both in men and women, and so it's very important for Native Americans to keep track of these types of areas in their body.
So, can you talk a little bit more about the most common types of cancers that, at least top 5, if you know them, for Native American men and women in Arizona specifically? I know it's going to be hard to speak about cancer rates amongst other tribes and other states.
Yeah, so in a nutshell, the most common type of cancer for both Native American men and women is colon health, colorectal cancer. You know, that's usually more prevalent. And women, breast and cervical cancer are more prevalent. You know, those are the ones that, you know, we see on top as well. And then specifically for men, it's a rise in kidney cancer, not necessarily in the nation as far as a whole, but if for Native Americans within this area, Southwest kidney cancers, digestive area cancers like the gastric cancers in the stomach, or some colorectal cancers. Uh, you know, those are areas that are usually affected the most. Others are, you know, liver, hepatic cancers that we see.
Um, so are there any types of common taboos, myths, misconceptions about cancer that we should debunk? Being health educators and working with patients and community members, what types of things have you heard in the community that may be misinformation that we can continue to educate people about?
Yeah, when I, you know, in my former capacity, when I used to work as a cancer health educator, you know, a lot of things when I went around, a lot of the you know, just general population uh, wondered if cancer is contagious and can you catch it like the flu or cold? Like right now, is it contagious? And you know, although some cancers we know of may result from a viral infection, like human papillomavirus (HPV), um, cancers are generally not contagious. Most cancers are self-contained within the host. So um, you know, a person going through cancer, stage 1, stage 2, stage 3, stage 4, getting their chemo, you know, therapy, radiation therapy, all of that. The biggest thing they need is support and love and help and reassuring and assurance of, you know, that care. And so, you know, being there is not going to put you at risk for being exposed to cancer for that person. So that's the biggest thing that I see that I would like to debunk. But that doesn't go without saying that, you know, in the area, if the environment is high risk for, you know, radiation or chemical exposure, things that can really throw human cells out of whack, then there could be an increased risk for cancer. For example, Church Rock would be one big example, the community of Church Rock, and their that radiation exposure puts people at risk.
Do you have anything else to add, Kimberly?
With that, what anything, I actually don't have anything else to add on that one.
Okay. So can you guys tell us a little bit more about your upcoming prayer run event that I've seen on your feed?
Kim, did you want to talk about that?
The Sacred Mountain Prayer one has been scheduled for June, but that has been postponed or has been canceled due to the pandemic. To get more information on the event, we have it on our website as well at nacainc.org.
So do you guys have any other events coming up once physical isolation ends?
We do. So we are working with you, the U of A outreach team, cancer outreach team, and as well as the Northern Arizona Native Americans for our cancer prevention. Those we're trying to set up an event, a 5K 1 mile run. It was supposed to be for recognition for the Colorectal Cancer Awareness Month in March, but because we had to postpone that event, we hopefully are going to get a date. We haven't determined that yet, but we can hopefully get a date once everything clears, and possibly by the middle to the end of this year. Hopefully, I'm hoping that we can get something going there, but keep your ears open and check our Facebook page or our social media pages, as well as our website at nacainc.org for updated information. The Sacred Mountain Prayer Run, I've heard that we might possibly do a virtual challenge, but we'll see. I don't know how they're going to do that, but I mean, how they're going to run that. But that's something to keep a lookout for as well.
So that's kind of something that our team is doing right now. So we're with the College of Public Health here and at the University of Arizona. They have a 10,000 step per day challenge. And so they're actually doing it virtually. So our team is currently in the process of doing that. So we're almost through with it. So April has been very long for some of us who don't always make the 10,000 steps per day, but we're getting there. So maybe that's something else you guys can also consider. But we definitely cannot wait to come up to Flagstaff, especially during the summer or towards the fall. It's going to be much, much prettier and cooler than it would be here in Tucson, where it's going to be hot, or in Phoenix. And so we are excited about that. And I know one of the things that we were able to do when working with your with NACA is that you guys were able to do a proclamation for the month of March to recognize colorectal cancer for the city of Flagstaff. You want to tell us a little bit more about that?
Yeah, so we were happy and delighted that the city mayor of Flagstaff was able to sign a proclamation to recognize the National Colorectal Awareness Month. And so that's one of the things that was a highlight in that month, a positive with everything else going on. But, we weren't able to celebrate the highlight as we liked. But, we're waiting for that party. So once everybody's ready to go out and run and spend some time together, then we'll be there. We'll just keep our fingers crossed and hunker down for the moment.
Great. And so I want to thank you guys for joining us today. And so we have some upcoming webinars in the next couple of weeks. And so next week we have Mindy Griffith from Bagot, who's going to talk a little bit with us about cancer patient resources. After that, we have Beth Hyde from Banner Health, and she'll be talking with us about our Cancer Center Nurse Navigation Program, followed by Jennifer Erdrich. She is an oncologist here at the U of A, and she's going to talk about cancer care at tribal nations. And then we're going to end the month with Dr. Jennifer Hatcher. She works here at the University of Arizona Cancer Center, and we're going to be talking about her Dream Scholarship Program and current community outreach and engagement plans. And so with that, I would like to open it up for anyone if they have questions. We have included Kellen and Kimberly's email, so if they have any other questions about a program or services that you guys have ongoing, you can definitely contact them there. Or if you have any other further questions for Desiree and I. And lastly, we have our social media for the Cancer Center COE program. And so we'll take a few moments to see if anybody has any questions, whether it be on Zoom right now or through social media.
So, hello. Hi, Kellen and Kimberly. This is Octavio. I am also part of the team. I'm a health educator here with the Cancer Center, part of the COE team. So yeah, I was really bummed too that we had to postpone the fun run that we had scheduled for March 28th out there, Buffalo Park in Flagstaff, but looking forward to hopefully getting that rescheduled and yeah, better weather. We'll be out there soon, hopefully, fingers crossed. But I do have a couple of questions for you guys. So do I need to reside in Flagstaff and be Native American in order to receive services from NACA?
Great question. So the first one is, do you need to reside in Flagstaff? Yes, we do have work in a service area. We're a part of the Navajo area through the IHS. And so that kind of extends down to our area in the Flagstaff, greater Flagstaff area, in and around Flagstaff. We've, reached out to people in Williams area, Fort Tut Hill, down to Fort Tut Hill, to the west of us, which would be, towards Twin Arrows, just meeting at kind of border where the Winslow IHS takes over. So yeah, we do operate within a service area within the greater Flagstaff area. But as far as the second question, do you need to be Native American? No, we cater to both. The only benefit to being Native American is that you do receive your, with a CIB certified certificate of Indian blood, or your tribal card, that you're able to receive services for free under the IHS.
That's awesome. That's really good to hear. And also that, the underserved population in the area also gets to benefit from you guys' great services. The other thing I had was, given that there's a lot of movement towards telemedicine right now, we can't really go into your guys' facilities. Has that been an issue in terms of just the infrastructure with everybody having to have high-speed internet? Is there a need for more support in terms of that sort of infrastructure to make sure that everybody can still get that access? Because it is kind of a privileged position that some are able to continue to work from home and that kind of stuff, whereas not everybody has that same access.
I'm kind of in that area where I am still getting set up for that service to meet our patients. But I know, Kim, you've been going to the clinic because you live closer there. Have you seen any drawback or any successes in that area with telehealth from our providers?
The providers, I have been seeing them work with their patients via telehealth, so I have not seen any issues. Patients are still able to call in and speak to the nurse or the provider, so they're still getting services the best they can provide.
Excellent. And then my last question is, how can we support you guys? Do you guys take donations down the road once this pandemic stuff clears up? Is there volunteer opportunities?
Great. I'm glad you asked that. We are a nonprofit as well. So the extension, although we're provided federal funding through the IHS, Urban IHS, the rest of our programs are actually being either furloughed or put on administrative leave. And so because we are a nonprofit and so having that ability, and could accept donations, monetary donations toward NACA. That again goes into a general pot, and then it goes back down to the services offered to the community. Volunteerism, we do offer that as well through our HR, human resource. So you would call NACA. We do actually have a link of and a checklist of what you can do to either volunteer or provide internship hours to our services. That's going to be at nacainc.org.
Excellent. Those were all the additional questions I had for you guys. Thank you so much.
You're welcome. Thank you.
Thanks. I don't know if we have any other additional questions for our guest speakers.
I just checked our social media and there's no questions there.
Okay. Well, with that, I'd like to thank both Kellen and Kimberly for your time and joining with us today to just chat to see how everything is going with NACA and sharing some very important information about all the hard work you guys are doing and educating our viewers. And so with that, I'd like to thank you. And then again, you guys are always invited to listen to our upcoming webinar series. And with that, I guess I'll end it here. And so have a great day, everybody.
All right. Stay safe, everybody. Bye.
Bye.